going to share my screen. All right, so I'm just going to start by talking about, why do we do epidemiology? Well, people get sick, and epidemiology is the fundamental science of public health. It's kind of like the basics. All of the public health, anything that's data-driven in public health, from understanding what are the risk factors for disease to understanding what prevents disease. This is all epidemiology and uses epidemiologic tools. So it is a science, it is quantitative. Who gets disease? What are the characteristics of the people who develop certain diseases? How do they develop it, or how do they contract it? Why are some people and populations more vulnerable than others? So there's also that aspect of health disparities. What are the main risk factors? Some are maybe preventable, some are not preventable, but in general, we're interested in improving public health, figuring out how disease can be prevented from a very rigorous, data-driven perspective. So it's quantitative, it's logical, it's evidence-based. And how can we best design basically experiments or studies on human populations to answer these questions? A lot of our studies are just observational. So we're not doing like a lab, you don't think of it as we're lab rats. We're just watching people, taking data, collecting data, understanding what is happening in populations and using that data to scientifically, and we run mathematical models to figure out what are the most important risk factors for disease, and are those risk factors causal or not? So epidemiology is still one of the fastest growing professions. I checked the website this morning. They are still predicting an increase over the next decade, faster than other careers on average. The median salary for a master's degree is around $81,000. And you can, of course, apply this knowledge and the skills you're going to gain to your current career, which it sounds like some of you are interested in doing. And you are going to gain a lot of really practical skills in this program. But you can also look for employment maybe in other arenas like health departments, medical centers, insurance companies, pharmaceuticals, energy industry. So I did a little survey of our MS graduates from this program and discovered that 30% now work for industry, medical research, or consulting. 40% actually went on to pursue a PhD in epidemiology, and 30% went to medical school after completing their master's in epidemiology. So there's a few master's in epidemiology online programs in the United States. So what makes ours different or special? We have a small program. It's relatively new. It began in 2024. Although our MS program in person began, I don't know, 15, 20 years ago, but we just recently converted it to fully online in 2024. So we have been teaching a master's curriculum in epidemiology for a while. We are experienced in that. So we have a small program, which means you do get a lot of individual attention. Right now I have 4 students in my class, so I'm able to, email them back and forth, meet with them one-on-one if they want to. It's not required. But all of the faculty have a PhD in epi. Faculty are very dedicated to teaching. We have a dedicated online learning center called the Delphi Center for Teaching and Learning, which provides dedicated support for online learning to improve the quality of our programs. And in the Epi-MS program specifically, we aim to provide excellent, rigorous training in epidemiologic methods, study design, and also computer programming to give you those, again, practical skills that will be easily transferable to other jobs or a career in epidemiology. And the program is fully asynchronous. There are no synchronous requirements for any of the classes. This is a breakdown of the curriculum in rough order of how you would take them. There's some wiggle room though. The first 2 classes are what we consider to be the core classes that you do need to take before you decide to, continue with the program. We need to make sure that you can be successful in these two before you go on to the rest. So that's statistics and epidemiologic methods. Then we have clinical epi, biology of disease, environmental and occupational epi, the theoretical foundations of epi, which includes some history and historical context of how we got to where we are. Survey research methods, again, that has a lot of practical applications. Computational epidemiology using R programming. Study coordination skills, which is how to design and implement an epidemiologic study. And then finally, another programming class, computational epidemiology with SAS, which also contains the culminating project for the MS program. So it's a total of 30 credit hours. This is an example of how your semesters might break down. So there's 10 classes. So that breaks down nicely into 5 semesters if, say, you wanted to do 2 classes a semester. So this is just an example of a program plan for taking 2 classes per semester. You can take the program in as little as 4 semesters, and if you really want to stretch it out, you could go as long as 10 semesters, just taking 1 class per semester. So here's an example if you wanted to take 9 semesters. But like I said, your advisor will work with you to work on your individual flight plan. For admission, you're going to apply through the U of L Graduate School with transcripts and a CV, a personal statement describing your background and interest in epidemiology, 2 letters of recommendation, academic or professional, and an undergraduate GPA of at least 3, and 2.75 can be considered for provisional acceptance, but you need to maintain a 3 once you are accepted into the program. Official transcripts of all your degrees, and college algebra or higher level math with a B or higher, because we do, dig right into the statistics and computer programming. So we want to be sure that you can be successful in those classes. It's an important aspect of the program and generally of being an epidemiologist. If you're an international student, the program is open to you. And if English was not the primary language of instruction in your country, then you need to take one of the English proficiency tests. It is important to note that students will not be issued a US visa if you're admitted to this program because it is fully online, because there are no on-campus attendance requirements. The tuition is $850 per credit hour plus a $10 fee per credit hour because these are online courses. There's a military-friendly tuition rate, and there's also financial aid available if you are going at least half-time. So that would be at least 4.5 hours. Full-time for a graduate student is considered to be 9 hours. So in other words, if you're taking 2 classes per semester, you would qualify to apply for financial aid. So these are just some frequently asked questions. And then after I go through these, then I'll open it up and you all can ask some questions. The materials delivered through an online learning system, Blackboard. Each course contains content modules, which might contain video lectures, assignments, assigned readings, and group work is a component of some of the courses, but not all of them. Fall and spring semesters are 15 weeks long, and the summer semester is compressed a little bit into 10 weeks. You can attend part-time, you can take breaks if you need to. And the application deadline is July 1st and for August admission. But we do review applications starting in January. So if you want your answer sooner, you can go ahead and apply and we will review it usually within a few weeks of receiving the application and get an answer to you. There is not a thesis requirement for this program. Elements of research are covered within the courses. If you want to, you could add an independent study to your flight plan for independent research if you can find a faculty member who's willing to work with you, but that's not required for graduation. So the strength of the program, again, it's fully asynchronous. We really have a strong emphasis on epi methods and study design, and statistics and programming. All of the classes are taught by full-time professors in our department who have a doctoral degree in epidemiology. And just some of the topics that our faculty are experts in include chronic disease, environmental epidemiology, infectious disease, genetic epi, social and behavioral epi, and maternal child health. So we really cover a broad range of substantive topics in epidemiology. There is financial aid available. Just look at the U of L website. Okay. Oh yes, what questions do you all have right now? You can put them in the chat or just shout them out.
Do we have to take the math online? Is it offered online? Are there options for books, like physical books?
I'm not sure exactly what you're asking. All the classes are online. Is that what you mean?
No, ma'am. If we have an actual hard copy book or books are online.
Some of the classes have hard copy books. They might have digital versions available online as well. I'd have to look at each class and see what is the, I mean, I'm sure your instructor could work with you, like if you think you might have trouble getting the physical copy of the book, or if you tell me a little bit more about your concern.
Like, I know with another school that I was attending, we had the option to rent the book, the actual physical book from Pearson, and we could still access the online book too.
Mm-hmm.
That's what I was asking. Is there an option for the book, or is it straight online?
Gotcha. I'm not sure. It would be, I would have to look at that on a course by course basis since there's 10 different classes, and they each have different requirements. So if you send me an email, I can do a little research on that and get back to you.
Many of the texts nowadays in epidemiology are available usually on Amazon in both e-text as well as hard copy or paperback, and they vary in price as to what format they're in. And I think probably most of our courses are utilizing those sorts of texts. Some of them probably don't have a text requirement.
The book would be available on the Blackboard platform, right?
Right.
Okay, so that's something like you can use a tablet for, and you can look at the book that way, and then take your notes from there. Hello? Oh, okay. And then the other question I have was about the math. Are you guys offering the algebra online, or do we have to come in with that math?
So U of L does offer an online math course that would help you qualify for that requirement if you do not meet that already. And if you need to take that math class before you apply to the program, you could do that. Again, send me an email and I will sort of tell you which class to sign up for and help you get started in the right direction.
Okay, and is this session going to be available for us to download and watch later?
Yes, it is being recorded.
And your email, would it be in that, or can you email us directly?
Yeah, I'll put it in the chat right now.
Okay.
Okay. Okay, Patrice asks, how far back do you go when it comes to transcripts? I placed out of college algebra, went straight into statistics, but this was 22 years ago. Let me see here. Well, we just need anything after high school, basically. So we would look at your transcript, and if it's a higher level statistics class, like a 300 level class, then that might qualify you for the math requirement.
All right, Taylor, thank you so much for your presentation. Yeah, it has been quite insightful. I had a question, though I joined a bit late, maybe 4 minutes late. My name is Callistus because I'm calling from, I'm tuning in from Kenya, that's East Africa. I have an interest in studying epidemiology. I have undergraduate, I have a BSc in health science, and I'll wish to do my master's in epidemiology. My question would be, do we have international students scholarship in the university? And number two, for those students who are willing, of course, to take the course, but they have no maybe enough cash for every credit, because I've seen the amount is $850. Is there a way that you offer loans for these international students, or they must just have to pay in full before they're allowed to do the course?
We don't have specific scholarships for international students for the master's program. You can apply for financial aid through the university website, and that has different kinds of loans and grants. And I wasn't sure about I think you had one more question.
The other question, can you hear me? Can you hear me?
Yes, I can hear you. Yeah.
Thank you so much. The other question was about the scholarship. Do people offer scholarships for students, international students, like us from low-income countries?
Not that I'm aware of. Rick, what do you think, Dr. Baumgartner?
I think it's a question for the university's International Center. Our School of Public Health does not have any specific scholarships of the type you're asking about. Not at the master's level. But once again, the curriculum is entirely online, and that facilitates international students as far away as Kenya to be able to enroll and work on getting their master's degree. But no, we don't currently have any kinds of scholarships that we have available.
All right, so thank you so much, Professor. So maybe the last one, is it possible for a person like me to enroll and be given a chance to pay in bits, even if maybe the amount I'm paying is not enough for the entire 1 hour credit, or it has to be in full?
You can pay per semester. You can pay as you go, so you don't have to pay for the whole program at once. Ariel, do you want to add anything to that?
That's correct.
Yeah. The university works on a per credit fee. So a 3 credit hour course is, I don't know, it's approximately $400 or $500 per course, I think. Is that correct?
It's $850 per credit hour.
Per credit hour, yeah.
So a 3-hour course would be around $2,500.
Right.
Okay, other questions?
Thank you.
Welcome.
I have a question. I've also been looking at the biostatistics masters, and I know they're very different. Like epidemiology would probably be like a little bit less quantitative, more
Yeah.
disease based. But do you have any recommendations for like students that are in between the two?
What do you want to do with the degree is what I would ask.
Mm-hmm. So I guess in general, I work for a milk company and we have like a lot of milk testing data. So it's not necessarily like disease related, but I mean, it can be. We also have like a large culturing sort of program as well. It's very specific. Like, and so basically, like, I'm more interested in analyzing that data
Mhm.
sort of set.
Yeah, I mean, in epidemiology, we don't just look at diseases, we really look at any characteristic. You know,
Mm-hmm.
what are the factors associated with that characteristic? Um,
Mm-hmm.
so that would still, the difference is in the epidemiology program, it's a little bit more, you know, we talk more about the biology of disease, we talk more about the history, we apply the methods. We don't go very deep into the theory behind the methods. Like it's not as mathematically rigorous as the biostatistics program would be. So
Mm-hmm.
they might be doing, you know, more things like mathematical proofs. We skip over the
Mm-hmm.
proof and tell you, okay, this is the equation. This is when you need to apply it. This is how you do it
Mm-hmm.
on the computer. So ours is a little bit more just practically focused, I think.
Yeah, our
Mm-hmm.
approach is practice oriented, and the less emphasis on the theoretical underpinnings of the methods, more in their correct application. Big emphasis, as you saw, on you know skill use of at least two different software programs, SAS and R, and the a much more public health orientation to it. But epidemiology, is foundational not just to public health but to medicine. So, a lot of evidence-based medicine draws on epidemiologic research. Um, and we come at it from mainly a populational perspective, but we also have a course that, in fact, I teach that has a very more clinical focus. And that one may be, more directed at the kind of data that you were talking about, understanding how to go about parsing and analyzing, um, having to do with a lot of um, clinical biomarkers and such, and what test results not just mean, but how they were developed to begin with.
Thank you.
You might just want to look at the list of classes and read the description of the classes to see what sounds more interesting to you
Yeah.
and maybe more applicable to your current job.
All of our syllabi should be available online.
Yeah. Other questions, anyone? Looks like Ariel's answering some in the chat. Thank you.
Thank
Yes,
you for your time.
Mhm. You're very welcome. Yes, we will, Callistus, we will email you the link to the website that has the application requirements.
Yes, we really thank you for your interest. We're one of only a handful of completely online MS in epidemiology programs in the United States.
Yep.
We maybe only have two possibly 3 competitors at this point.
Okay, well, I won't take up any more of your time, but if you do think of any more questions, feel free to email me or Dr. Baumgartner, and we will do our best to get them answered as soon as possible. Have a great day this cold December, or wherever you are, whatever the weather is. Have a great day.
Yeah.
And thank you very much for attending.
Thank you.
All right, y'all
Thank
too
you.
have a good one and have a Merry Christmas.
Thank you. You
You
too.
too.
Thank
Bye.
Bye bye. Merry Christmas.